treatment elements come up, such as mashes and caches, we were receiving primarily patients who had been stabilized and then flown back to our location, which was near the Iraqi border. I'd never seen anything like the shrapnel wound before, and it was quite shocking at first. The amount of tissue damage involved, the distribution of the wounds. I'd never dealt with it. I guess the closest thing to it at home would have been a real bad auto accident. It was also a little bit difficult seeing our guys. Luckily, we didn't see too many of our guys. I'd say 70% of the folks we treated during the ground phase were Iraqi EPW.
Okay.
Okay. Hey, why don't you turn a little towards me? Yeah. There you go. Okay. First of all, tell me what your name is and what unit you're from and where you're from.
Okay. My name is Patricia Blackman, and I'm from the Birmingham unit, the 109th EVAC Hospital. And I reside in Pratt City, which is also in Birmingham, Alabama.
Did you get a rank?
Yeah, I got it.
Oh, okay.
Okay. I understand y'all had some experience with EPWs. Why don't you were telling me one particular case about EPWs. Why don't you go and tell me a little more about that?
Okay. As an OR tech, we worked in the operating room, and we had one particular EPW, and we were going to do surgery on his toe, which we had to amputate a part of his toe. But we were going to give him a local anesthesia, local anesthetic into his foot. And he was so afraid because he thought we was going to cut his foot off. So we really couldn't give him, the anesthesia in his foot. We had to give him a general anesthetic to knock him out because he thought, that we were going to cut his foot off. And he kept telling us, no, don't stick me in my foot. Don't cut my foot off. So.
What was the general feeling you saw among EPWs? How did they react to you guys?
They was friendly towards us, and they were like, they tried to communicate as best they could, but we couldn't understand, and we had to have an interpreter most of the times. And they was just real friendly. They were glad.
Some of the injuries were pretty bad?
We had a lot of gunshot wounds, not real bad. I didn't see any. I had shoulder wounds, thighs, buttocks. We didn't have any. I didn't see any real serious wounds.
Okay. Good? Okay.
Right, we're rolling.
Okay, can you tell us your name and what unit you're in and where you're from?
My name is Sergeant Bessie Simmons. I'm in the 109th EVAC Hospital, Birmingham, Alabama.
Okay.
I live in East Lake, which is also in Birmingham.
Okay. You were telling me a while ago that you weren't really scared even though y'all were real close to the front lines. Tell me why.
I just didn't have any fear in my heart. I put God in front of everything that I do, so I don't ever have any fear.
Okay.
He'd ease me.
And you were telling me about some of the Iraqi prisoners and how they acted. Why don't you start from the beginning and tell me that?
The Iraqi prisoners seemed to me were fearful of us at first, but you could tell that they were hungry. And after they had eaten, they were full of smiles. I'd wave to them and they'd wave back. And if they were hungry, like I said, they put their hands to their mouth, like hungry. And they'd just grin all the time. I think they were misled about the Americans. I feel that they were told that we would harm them in any kind of way. So after they found out exactly how we would treat them, then they were happy.
Okay. Are you proud that you were here?
Yes, I am.
Remember you said the whole thing.
Happy?
I was proud that I was here.
I am very proud that I came to Saudi Arabia for a mission and completed that mission to help aid patients.
And now you're ready to go home.
I'm ready to go home. Yes, I am.
Okay.
That was excellent.
Okay. Thomas, just like normal, right?
Right. Sergeant Waldrell.
Yeah, staff sergeant.
Staff. Okay. Where are you from?
Birmingham, Alabama.
Where you live in Birmingham?
Norwood Boulevard.
Norwood. So it's in the city limits.
Right.
Okay.
Okay, put your hat back just a little bit. There you go. I want to see your face. All right. Okay.
Okay.
We're rolling.
When we talk, you look at me. Okay. And don't worry about messing up. We'll just cut it out. Okay.
All right.
How long? What's your name and what unit you in and where you from?
My name is Staff Sergeant Wardrell Thomas, and I'm a member of the 109 from Birmingham, Alabama.
Okay. And you live in Birmingham?
Yes.
Okay. How long you been doing this job, and what do you do?
This is my 20th year, and I'm the assistant NCOIC of the operating room.
Okay. And what kind of things do you do in that job?
We basically fix and repair broken bones, flesh wounds, anything that we can't do on the outside.
Okay. What kind of things did you see in this force you hadn't seen before?
Basically nothing, since I'm an old vet. This is my
You've been
second
on?
trip over here. So basically I think that we've seen more fragment wounds and stuff like this than we have in the past.
Where were you in the past?
I was with the 1st Cav in Vietnam.
What'd you do with them?
I was infantry.
Oh. Okay. So that's good because you kind of know both sides of it. You know what they're going through when they come in. You tell us a
Right.
little about that.
Well, they were a bit fretful, scared that we were going to do some harm to them. But after they found out that we were here to really help them, try to get them on the mend, they seemed to be more at ease.
Okay. Are you pleased with the mission? You've seen enough of them around. Do you think this unit's done a pretty good job?
Yes, sir. I think that they handled their mission as well as they could, and I'm overall satisfied with what we've done. I feel like that more or less, I'm sorry that it was so many of them, but I'm glad that it was not as many of us.
Okay, great. What else, bud?
Okay.
Okay. Why don't you start off with just telling us your name and what unit you're in and where you're from?
Okay, I'm Sergeant First Class Jimmy Jones. I'm with 109th Back Hospital in Birmingham, Alabama, and presently I reside in Stone Mountain, Georgia.
Okay. Tell us a little bit about statistics you just gave me about how many you treated and how many died there, etc.
We had over the course of the operation, we had approximately 230 patients that were admitted into our hospital. On an outpatient basis, we had over 550. That was for follow-up treatment. We had 12 actually who were either DOA on arrival or died within the hospital. The majority of those people were either Iraqi or Saudis. The majority of Americans that we saw were actually injured or died as a result of accidents, either playing with an AK-47 that they picked up, or letting a grenade go off inside a tank, or speeding on the highway. That was the unfortunate side of what was killed. We saw more people, more Americans that were injured as a result of accidents than of war casualties.
Thanks, Sergeant Brown.
Thank you.
Sorry.
I love you know about that. I think I'll cheat the horse you do.
Not over there in that bucket. What bucket?
Your neighbors.
From
Huntsville, Alabama.
Huntsville, okay. Jerry, what's it been like?
Oh, it's been exciting. Exciting. It hasn't been a vacation, but we come over here to do an air mission, and I think we did it, real well. And now we're all ready to get back to Huntsville or Madison County.
I guess this is the bad part of it, that you've got to wait around getting things cleaned up to get home.
Right. Well, it's just part of the job. We expected that. We were out in the desert there, and all our equipment's real dirty and everything, so we just got to clean it up. That's just part of it. And we're willing to do whatever it takes to get back home.
Hold on.
My name is Major Willie Mae White of Birmingham, Alabama.
Okay. Okay. The question I have is very simply, what's it been like? What do you have to say about your tour over here?
I would say that my tour has been very educational. It's something that I did not expect, but however, it has not been really bad. It hadn't been all that good either. I've seen better days, but we made the best of it. We accomplished our mission with very little difficulty, and I would say that it's been a great tour, and I really have learned a lot.
Of course, a lot of people looked at the National Guard and they were concerned whether the National Guard could do the job. I presume they probably did it as good or better than those who do it all the time.
Sure, the National Guard makes up about 70% of the armed forces, and we did a job. We came over here to do a job, and we did it.
Of course, it's been a hardship for some, I'm sure, but and I'm sure you're looking for tremendous support back home when you get back.
Sure, I'm looking for support. I would have to say that the American people have just been super. The support that we got was just magnificent. We couldn't have asked for anything better.
It's bound to have been tense at one time, probably when the Scuds were coming in. This has got to play on your nerves.
Oh, I tell you, I'm the best Scud ducker in Saudi. It was quite an experience. I tell you, I got a lot of practice getting in and out of my chemical suit. And I tell you, my gas mask became my baby.
And of course, all that training beforehand paid off then.
It certainly did. It certainly did. I mean, practice after practice made perfect.
And I'm sure there are a lot of people back in Birmingham that you'd like to say hi to.
I would like to say hi to my friends, my family, who has been very supportive of this mission. And of course, I could not, go any further without saying thank you to our God, because we have been certainly sustained by the prayers of the American people, and they have just been tremendous.
Okay, name first.
Hi, I'm Bob Joyce.
Sergeant.
Sergeant E6 Joyce.
Okay. From Huntsville?
Huntsville.
Not Lacey Springs?
No, I'm from Huntsville. I work in Decatur.
Oh, okay. Very simply, the question, what's it been like? What's the tour been like?
Well, there's no saying that war is a period of extreme boredom separated by terror, and I guess we've had our few minutes of terror every now and then and a lot of boredom.
To a certain degree, y'all were right up on the line when the troops moved in.
Yes,
and that had to be a tense moment.
It really was. But as a group, we really pulled together during that time. I think it just made us a lot stronger.
And I'm sure you're appreciative of all the support back home.
Oh, I sure am. Couldn't believe all the letters from people, and I can't say enough how much that really meant to us to get those letters from back home, from all the people that wrote to us. We're truly appreciative.
So there's no doubt the 109th did what they were supposed to do.
We